to this day, doctors, by and large, aren't admitting this. The federal health officials still aren't. The media certainly isn't. I mean, all these people, members of Congress, they cut videos. Get that jab. And Stephen Colbert, all these people push this on the American public, on the global public. So at this point in time, there's such cognitive dissonance. They don't want to believe that something that they mandated, coerced, recommended, pushed on people killed them or permanently disabled them, which is why I cannot get on a major news network with what I consider is the greatest scandal in government history.
You know that the COVID vaccines are toxic and that they cause way amount of adverse events, more than any other vaccine that's been recommended. In fact, let me just play you a 30-second clip here to explain this to you.
Swine flu vaccine, 1976. There was one serious adverse event per 100,000 people vaccinated, and the vaccine was withdrawn. This is good because the principle is we should do no harm, and the vaccine should be good for the individual that receives the vaccine. So vaccine was withdrawn. Rotavirus vaccine, Rotashield, 1999. 1 to 2 serious adverse events per 10,000 people given the vaccine. And again, rightly, the vaccine was withdrawn. At the moment, COVID-19 mRNA vaccines, there's one serious adverse event per 800 people that are vaccinated. And the vaccine is officially promoted. Now, some of you might be a little confused about this. Join the club, so am I.
So someone's doing something about it, or at least trying to shed light on it. It's Senator Ron Johnson. He's a Republican U.S. Senator from Wisconsin. And he's currently serves as the chair of the Permanent Subcommittee on Investigations, and he's been holding hearings on the COVID-19 vaccine. Welcome to the show, Senator Ron Johnson.
Well, Jimmy, first of all, thanks for having me on, because the majority of the legacy media is completely ignoring what I consider the greatest government scandal in my lifetime. And I love that you had that clip of Dr. John Campbell. He's been doing great work, as have you, in terms of trying to bring the truth to the American public. So thanks for having me on.
Oh, it's my pleasure. And you actually have a report, Unmasked, how Biden health officials purposely turned a blind eye towards COVID-19 vaccine safety signals. And you explain how they did masking. And I just wanted to tell, what is masking? It occurs when data about side effects from multiple vaccines are added together. This mathematically hides signals that are attributable to any one specific vaccine. It's a known flaw, and it was especially problematic when a new vaccine that is being administered to hundreds of millions of people is analyzed. And of course, someone at the FDA caught this, Dr. Sartzman. She developed a method to address this problem, and her analysis found approximately 25 previously undetected safety signals. And she didn't keep it to herself. Beginning in early 2021, she shared her findings with the FDA officials who are responsible for monitoring the safety of the COVID-19 vaccines. They largely ignored her and eventually told her to stop. And so this is what your report talks about, this masking and this using mathematical mumbo jumbo to hide the adverse events. Isn't that what's happening?
Correct. And Jimmy, because we have some time, if we can back up and just kind of lay some foundational information for your audience. The VAERS system, the Vaccine Adverse Event Reporting System, was established in 1990. Prior to 2021, on average, VAERS reported about 280 deaths associated with various vaccines, 280 deaths, anaphylactic shock, that type of thing. In 2021, with the advent of the COVID injections, they reported 21,000 worldwide deaths. So 280 on average to all of a sudden 21,000. Now, prior to the COVID injection, when you've got all this data, you're trying to sift through the data. And so they needed some sort of mathematical algorithms to analyze the data. And so CDC used something called proportional reporting ratio. So they're looking for disproportionate adverse events as a signal for a drug or for a vaccine. So remember that. PRR, that's what CDC used. The FDA used something called empirical Bayesian analysis. So two different analytical algorithms for looking at all this data, these thousands of reports that come in. So now fast forward to the end of 2020 when they got the emergency use authorization for the vaccines. I can quickly explain what masking is. 21,000 deaths in 2021. So you had Moderna. These are rough figures. So you had Moderna, let's say 10,000 deaths associated with the Moderna vaccine. And you had the Pfizer, about 21,000 deaths associated with the Pfizer vaccine, and then 280 deaths with all of the vaccines. So if you look at Pfizer, you look at 10,000 deaths and compare that to Moderna 10,000 plus 280, there's nothing disproportionate about that, right? It's equally safe, equally dangerous. Then you look at Pfizer, compare that to Moderna, 10,000 versus 10,280. Again, nothing disproportionate, equally safe, equally dangerous. But you and I, we didn't need a sophisticated algorithm in 2021 when you went from 280 deaths per year to 21,000. So now let's talk about what we have discovered because of Bobby Kennedy's commitment to radical transparency. We got 11 million pages. The FDA, CDC was not cooperating with us or Kennedy. Kennedy finally said, no, give him this data dump. So 11 million pages. We discovered that Peter Marks, the head of CBER, this is the division within FDA that approves vaccines and then surveils for safety, was warned by Dr. Anna Sharpsman that their algorithm is going to hide and mask safety signals. 26 days later, they developed a new algorithm and they showed Dr. Marks and senior FDA officials 25 safety signals on things like sudden cardiac death, pulmonary infarction, Bell's palsy, different types of strokes. For 3 consecutive months, they kept doing data runs showing more adverse events. And do you think Peter Marks and the officials at FDA pinned a medal on our badge and said, thank you, God, this is what we're looking for? We were searching for needles in the haystack. We were trying to find those little signals so we could warn doctors, we could inform the public so they had informed consent. No, the exact opposite. They told her to cease and desist. They said, we didn't ask for this. This isn't your job. Quit giving us these data runs. We talked to Dr. Sharpsman. She said she was viewed as a pest. So understand, on March 1st of 2021, FDA officials already knew the algorithm they were going to use was going to hide safety signals. They clung to that algorithm. They didn't use the new one. So they go lie to the American public and say, we're not seeing safety signals. Okay, that's the basic, main part of this story. There's more details. Go to CDC. They're using PRR. We found about that in our oversight probably late 2021, late 2022. A bunch of us, including Children's Health Defense, ICANN, myself, Epoch Times, we did FOIA requests. I wrote oversight letters. I wanted that PRR data because, again, I'm seeing the VAERS explode with these adverse events and deaths. I wanted to see, what do you know about it, CDC? What do you know about it, FDA? They refused to turn over the PRR data. That's the only thing we knew about. Finally, under pressure, probably from the Epoch Times, they turned over the PRR data, and there were over 100 safety signals showing that data, but they explained and said, no, this is all noise, this is junk. PRR is a bad system, just like they, by the way, dumped on VAERS. We're going to use a more sophisticated empirical Bayesian model that the FDA uses. That's the one that Peter Marks was warned was going to hide safety signals. So again, this is unbelievably corrupt. I know I probably went on too long.
No, keep going. Take all the time.
This is reasonably complex. But your listeners have to understand how thoroughly corrupt the FDA and the CDC was in hiding what they knew. What was obvious to those of us who just looked at VAERS, but you remember they were trashing VAERS, right? So let me do what I can only surmise based on this story. So let's put yourself in the shoes of Peter Marks. You've gone ahead under pressure, probably granted the emergency use authorization for these COVID injections. Now you're watching VAERS and you are seeing VAERS deluged with adverse events, right? They had the contractor that inputs VAERS reports had to hire 290 additional people just to clear the backlog. So you're freaking out. You just approved this thing. It's killing people. It's disabling people. But you just found out that your algorithm you've been using for how many years is going to hide in mass safety signals, so you cling to it. And you say, we have to be consistent. We can't change algorithms in the midst of a pandemic. We have to stay consistent. Just so happens that's going to hide safety signals. So you can go to the American public and lie, boldface. We're just not seeing safety signals. What adverse events we're seeing are rare and mild. And here's what's even sicker. Also in March of 2021, again, this is less than 3 months after the start of the administration of these injections, the NIH was beginning to diagnose and treat patients with these COVID injection injuries, about a couple dozen. They told them to stay silent. They said, we want to complete our studies so that we can give complete information to the medical community so they know how to treat this stuff. They never released that study until under pressure by the COVID, the injection injured. They finally released it in 2022, but they didn't tell anybody about it. They just put it on a preprint server, kind of like the Grinch stole Christmas. Solve world hunger, tell no one. So again, the NIH was treating people, vaccine injured. FDA was lying that they weren't seeing these safety signals. And as a result, the American public was not informed. Remember, Biden was out there saying this is a pandemic of the unvaccinated. They're saying vaccinate your children. They got it approved. They got it approved for children. Vaccinate your children so they don't infect your parents, your grandparents, and kill them. Of course, they never tested this. Does it stop transmission? Later on, we found out, no, it doesn't stop transmission. So people went ahead voluntarily and took this injection. Children died. We now know children died. That's been confirmed by the FDA when they've looked at the child deaths. And again, I think it's way understated. But people believe the FDA. Millions of people had adverse events. At least tens of thousands died without that information. Past March 1st, tens of thousands more people died without the information that the FDA should have told not only doctors, but the American public. There was no informed consent on these injections.
And so where does the corruption come from? It's just big pharma money and the promise of jobs and the rotating between so it's regulatory capture, correct?
There's no doubt about that's part of the problem. Okay, yes, big pharma has captured these agencies. They've corrupted them. But again, if you're the people pushing this, if you're the people that approved it, do you want to admit that something you approved, something you pushed on people, killed them or permanently disabled them? That's why to this day, doctors by and large aren't admitting this. The federal health officials still aren't. The media certainly isn't. I mean, all these people, members of Congress, they cut videos. Get that jab. And Stephen Colbert, all these people push this on the American public, on the global public. So at this point in time, there's such cognitive dissonance. They don't want to believe that something that they mandated, coerced, recommended, pushed on people killed them or permanently disabled them, which is why I cannot get on a major news network with what I consider is the greatest scandal in government history.
Yeah, I mean, we went from someone like Chris Cuomo, who was the most popular anchor on CNN, who was repeating big pharma propaganda that was lies, and FDA, CDC propaganda that were also lies, as you're revealing here. He went from doing that at the top of his lungs, and not only that, but discrediting anybody who actually was skeptical or had a question of the official government narrative, which is exactly what journalists are supposed to do. And then he himself got vaccine injured, and he got fired from CNN, and now he actually tells the truth about it. And he talks about early treatments such as ivermectin, and he talks about how he himself was lied to about ivermectin. So it takes them to get fired from their job in corporate media to finally be able to tell the truth. And the reason why is 70% of the funding for cable news comes directly from big pharma. And the reason why they advertise drugs on television isn't because they're actually trying to sell you that drug. What they're trying to do is make the media reliant on their money so then they can control what they say and what they don't say. And that's pretty obvious, right? At this point, we're the only country besides New Zealand since in 1997, Bill Clinton signed the law that allowed them to direct market to consumers drugs, which is the craziest thing. No place else in the world except New Zealand is just as corrupt as the United States. So take it wherever you want on that.
Well, so in my former life, I was a sales guy, sold plastic, right? You look at those ads that Big Pharma spends billions of dollars on major networks and on cable news. There's no way you would ever buy that product. There's no way a serious salesperson would put an ad like that and spend billions of dollars. Because first of all, at the end of the ad, it shows all the adverse events that could occur, including death. But you don't even know what these drugs are for. Does it teach you how to throw a frisbee to your dog? So those ads are absolutely useless, except for one reason, and one reason only: to buy the media, to buy the narrative. And so prior to 1987, you actually had serious journalism. I mean, Mike Wallace had a serious piece on 60 Minutes about the swine flu vaccine. It's one of the reasons it got pulled. You had Phil Donahue do it. You had other people, serious journalism. But once 1997 occurred, that's it. There had been some journalism on this, but by and large, the mantra of safe and effective. This is a pandemic of the unvaccinated. What adverse events you have are rare and mild. It overwhelms any kind of serious journalism. And quite honestly, people like you, who I'm sure you paid a pretty heavy price in terms of your career and stuff, speaking out. Thank you for doing so. But no, those of us who've tried to tell the American people the truth, we get vilified, we get marginalized, we get ridiculed. That's, again, why I'm so appreciative of what you've been doing here on your show and having me on here to talk about this.
Well, yeah, we know completely ostracized. I live in Hollywood, and so everybody completely ostracized me. I've been dropped from the invite list to everything, and I've been slandered left and right by people I've known for 30 years. People who've been on my show, people who've been my friends for 30 years, go on social media without ever having a conversation with me about it. Like, they would never say, "Hey, Jimmy, explain to me what you're saying about the vax. Explain to me what you're saying about." They just went right on social media and called me a grifter and a liar, and the worst, even way worse than that. And so, again, without a conversation. So it's the opposite of how science works. And these people have turned, most of those people are not religious or spiritual or believe in God. And as Carl Jung has taught us, that if you don't have a connection to the divine, your psyche still has a need for it. So what they've done is they've created science as their religion, and they've created Fauci as a deity. And of course, you can't question religion or a deity, or that makes you a heretic. So that's exactly what they've done. And of course, it's the opposite of how science works. Science works on questioning. There's no such thing as settled science. That's a made-up term, just like safe and effective. Again, we find out that they've been lying about everything when it comes to COVID. They lied about not only where the virus came from. They said it came from nature. We now know it came from a lab, and that was funded by Dr. Fauci. And even though it was stopped by President Obama, he went through a CIA cutout called Echo Health Alliance to keep that funding, that research going, which is so dangerous that it created this virus. So they lied about the creation of the virus. They lied about where it came from. They lied about masks. They lied about the vaccine stopping transmission. They lied about the vaccine stopping contraction. They lied about herd immunity, natural immunity. They lied about lockdowns, social distancing. There wasn't a thing that they haven't lied about. And you'll see every once in a while a mainstream publication will admit it. Like now, even the New York Times will admit that, yeah, lockdowns were a bad thing. All the people who were all pushing that, well, they eventually come around to admitting it, but it gets no publicity, and including what's going on right now. What are the news? You're doing amazing work with your committee, so here there's video. So there's videos of your hearings, and you have the top doctors in their fields The most cited doctors in their fields come and testify at yours, and it gets absolutely no coverage in the mainstream media. So here's the plausible mechanisms of COVID-19 injection causing cancer and attacks on scientific publications. So they can go... So they go watch that video, but nobody's covering. So do you have conversations with the people at the news media, and what do they tell you when you ask to come on?
They just don't have me on. No, I mean, trust me, my comms people, we are bugging these guys. I'm calling them out on, I was on with Jake Tapper on CNN on another subject, and I said, hey, Jack, I just sent you my report. You ought to read this and then have me back on. That was weeks ago. I just recently texted him, hey, Jake, have you read it? You're going to have me on? He said, well, I sent that over to our health department. So, no, I mean, the major networks won't. I mean, to CBS's credit, Major Garrett had me on their streaming service. Fox and Fox Business is having me on. You know, people like you are having me on. But no, this is, you know, I've been holding excellent hearings. Voice of the vaccine injured. We let people with childhood vaccine injuries finally have a voice to tell their story. And, you know, my ranking member, Richard Blumenthal, who has to be bought and paid for by Big Pharma, he literally held a press conference before that hearing and said, I hope nobody watches this. This isn't worthy. Doesn't have the credibility for people to actually watch this hearing. Again, we're having people whose lives have been destroyed by vaccine injuries, and he's telling people, look away. So, no, we've got a real problem here in terms of just the cognitive dissonance. You mentioned this is religion. You know, I don't know, you probably had Aaron Siri on. If you haven't interviewed him, he wrote the book Vaccines Amen, which just lays out the facts. And people that, again, we all understand the appeal of vaccines. If you just get a shot and that prevents you from ever getting a deadly disease, yeah, sign me up. And by the way, I got all the shots until I started getting educated on this, how there's not been proper studies and the vaccine injuries are completely discounted in the cost-benefit analysis.
So let me just play a short video of one of the leading, if not the leading cardiologist in the world, Dr. McCullough, and he's one of the top 3 most cited published doctors in the world also. And here's just a brief compilation of some of the stuff he said at one of your hearings, which they will never show on the pharma-funded establishment media.
80% of Americans took a vaccine. 20% didn't. 20% did not take a vaccine. The vaccine was never safe enough for me to take. Messenger RNA, devised by Pfizer and Moderna, has been chemically modified to be unassailable to enzymes in the body to be broken down. The messenger RNA is found in the human heart of people who die after the vaccine. It's found in the brain. The spike protein is found everywhere in the body. 3 studies now show the spike protein is circulating in the blood for 6 to 9 months after people take the shot. This part of the virus, the lethal part of the virus in the vaccinated, it's circulating in the blood. And then they take a booster, they get more circulating in the blood. It is a killer protein. It cannot be safe. It was not safe by design. Safety trumps efficacy. We cannot tolerate false drug claims. This is in the peer-reviewed literature. This is not misinformation.
Our first witness is Dr. Peter McCullough.
So again, that's a leading doctor, and what he's letting you know that we were lied to repeatedly, that they said when the vaccine went into your arm, it stayed in your arm and it didn't travel throughout your body. And what he's telling you is that, no, there's studies after study that shows you, peer-reviewed studies now, that shows you that it travels throughout your body, crosses the blood-brain barrier, goes to your heart, causes myocarditis, goes to ovaries, goes to testes, goes to kidneys, goes everywhere in the body. And there's still, most doctors don't know this. And the reason I know that most doctors is because the Democrats had a doctor named Dr. Scott on as their witness. And here you are asking him about this very point. Let me just play this quick video, and it shows you he doesn't know anything about it. Let's watch this.
Mr. Scott, how much do you know about the mRNA technology?
A fair amount.
So is the mRNA that's encapsulating the lipid nanoparticle, is that true mRNA?
It's a true mRNA?
I mean, true mRNA, your messenger RNA, degrades very rapidly in the body. Mm-hmm. Correct?
Correct.
So the mRNA in the injection? Is it true mRNA? Does it degrade rapidly in the body? Do you not know?
I do know. Yes, it does, but
it does.
sounds-
It does not. It's modified. It's modified mRNA, and it's designed not to degrade. And there are studies that show it sticks around the body. We don't know how long. The lipid nanoparticle. Do you realize that it was designed to permeate difficult to permeate barriers, like the blood-brain, like the placenta barrier? Did you know that? Did you believe when Fauci told us that the mRNA shot would stay in the arm? Did you believe that? It's a simple yes, no. I mean, did you believe? Do you believe the COVID injection stayed in everybody's arm? Do you believe that's what happened?
Primarily.
You think so, huh? Were you aware of the Japanese FOIA of the study that was conducted at biodistribution, where in rats it biodistributed all over the body, accumulated in the adrenal glands, in the ovaries? Because the lipid nanoparticle is designed to permeate difficult to permeate barriers, they knew, the designers knew, and they did a study that would biodistribute all over the body. But our CDC, Anthony Fauci, said it was going to stick in the arm. Now, do you know what the mRNA does? It's not a traditional vaccine, is it? Do you realize that? It's not an attenuated or a dead virus. It's messenger RNA, modified RNA, that's encapsulated in a lipid nanoparticle. It distributes all over the body, and when it attaches to a cell, it unloads its mRNA into the cell and turns the cell into a manufacturing cell of a protein that is toxic to it. Do you realize that? Are you aware of that? I mean, just yes or no. I mean, do you know that or not? Because I talk to a lot of doctors who don't have a clue.
He doesn't know anything. He doesn't. And this guy was brought on to testify as an expert, and he's a doctor, and he doesn't know anything. And that's my experience also firsthand is that most doctors don't know anything about it. Because people who become there, and you're not a doctor, and you would know, you understand it it's not hard to understand these things, right? So that's the whole point. You don't have to be an expert to read a study and know what they're actually saying. It's not, it's not Latin. We can understand it. You understand it. I understand it. Lots of people understand it, but they're never presented in the media. The only people who are presented are people like that who don't know anything, or people like Dr. Fauci who do know things about it and are intentionally lying. Do you think that anyone will ever be prosecuted? Because, as you pointed out, they knew this. This wasn't like something they discovered later. They knew this and did it anyway and lied anyway.
So let's talk about Dr. Jake Scott. He does a lot of TV appearances, so they kind of brought him in as this expert. I was pretty well shocked that he wasn't prepared, that he didn't know these things. But fast forward to a couple of weeks ago, we held that hearing on plausible mechanisms in cancer. And the person that Blumenthal brought in, eminent oncologist, she's chair or president of an oncology society, she didn't know it either. I mean, in her testimony, she said, this mRNA degrades within 20 seconds or whatever, 20 minutes in the body. And so I asked her pretty much the exact same things I asked Dr. Jake Scott, and she was every bit as clueless. You would think the Democrat staff would at least warn their witness after what Dr. Jake Scott went through, that embarrassing display of ignorance. They would have at least coached their eminently qualified oncologists to at least be aware of what the mRNA vaccine was. And by the way, she was definitively saying there's no proof that the mRNA injections cause cancer. There's no proof. Well, again, there's not going to be proof
if you don't look.
First of all, you're completely ignorant of what the shot is, and if even if it's in front of your face, you'll never acknowledge this proof. I mean, we had eminent oncologists that say, in their clinics they're seeing this. Dr. Wafik El-Diri, he's the one that wrote the paper laying out, studying 300 cases and laying out the plausible mechanism for that injection to cause cancer. All they're saying is, let's do more research, but these guys want to shut the research down. So we already know. There's no reason to look at this any further. We know, we're experts. There's no proof. End of story. Move on. You guys are whack jobs.
So speaking of cancer, here's one of the leading cancer researchers in the world. Heralded before he started talking about COVID and the link to cancer. I don't know how you pronounce his last name. Angus
Dalglish.
He's a professor emeritus of oncology, City St. George's University of London. He's written over 500 papers that have been submitted and published in medical journals about all things from HIV's linked to cancer, all things related to cancer. And here's what he had to say.
Evidence on this. I'd just like to point out that I have done, as you say, I've been in cancer immunotherapy for over 3 decades, and I have made big advances in the treatment of cancer with immunotherapy. So this sets the scene that I became aware in early 22 of my patients who've been stable for years, mainly melanoma patients. They'd had several different types of immunotherapy, and in 6 weeks, I saw 6 patients relapse with melanoma. They'd been stable for 3 to 18 years. They felt well apart from the relapse. And being investigative, I asked, what was the thing that was common? And the thing that was common is they'd all received a booster vaccine from their general practitioners. Now, I know that these cancers are totally controlled by the T-cell response, so I immediately suspected the T-cell response was being perturbated by the cancer. And initial investigations showed that this was likely to be true. However, there was then a paper published by some doctors in Madrid, which, and I quote, the paper is called "The Evidence of Exhausted Lymphocytes After the Third Anti-SARS-CoV-2 Vaccine Dose in Cancer Patients." I mean, this was absolutely staggering that they showed across hundreds of patients that you get this T-cell suppression. Hard on the heels of this were then numerous reports that following the booster vaccine, we were getting IgG immunoglobulins switching, so you converted the immune system from being aggressive fighting invaders to one of tolerization. So therefore, the immune system was tolerating the cancer, and this was the reason we were starting to see it. However, it is important at this stage to say that we were getting reports after I first reported this of other cancers. And my initial observation that this is all due to T-cell suppression started to fade into the perspective that other actors were at work with the vaccine, as it were. Colorectal cancer was being reported by my patients, by my fellow surgeons, as presenting late, stage 4, not stage 1 or 2, and early, in patients in their 20s and 30s and 40s, in a way that we have not seen before. And then in my own practice, as I was looking for patients who'd had other cancers, I noticed that they too had booster vaccines, and I list them in my report. They go from everything from the common cancers, from breast, prostate, etc., and all the way through to some really unexpected ones, including glioma, and more recently, hematological malignancies. Now, looking at the literature as to why this could be, and I'm involved in 2 big publications. One's been accepted prior to changes, and this shows that there are remarkable, at least a dozen mechanisms where messenger RNA can insert into the DNA and activate oncogenes, and more importantly, and especially the long term, they can suppress the suppressor networks, which means if a cancer is starting to evolve, it would normally be maintained, controlled, and this mechanism is being prevented. And the number of people who've shown this is quite enormous. So as an oncologist, who I'm starting to see that it's not only my patients now, it's people I know really well who are going down with cancer, and they're going down more aggressively. And the treatment is not working nearly as well. And I'm used to people saying, oh, there's no evidence that the cancer is increasing and that there's anything to do with the vaccine. But I can assure you from the patients that I have seen, that many have seen a dozen doctors before. Not one of them has ever asked the vaccine history. So of course they see no evidence. And my full detailed research into the messenger RNA vaccines, and I was on the scientific board of a company claimed to be the messenger RNA vaccine company for 5 years, and left 8 years ago. So I know a lot more than the average clinician. And myself and others feel that there is no way you can control this technology and its use for future.
So there he is telling you the mechanism of how the mRNA vaccine suppresses your own body's immune system, your T cells, and it makes it tolerate cancer, which is why people are showing up with what they call turbo cancers. All of a sudden, people in their 20s, 30s, and 40s showing up with stage 4 cancer. And so they'll say, oh, there's no such thing as turbo cancer. But of course, again, this is not a quack. This is not a fringe doctor. These are the leading doctors in the world telling you this. And of course, they're being suppressed and discredited. And now there's been a move to make all the vaccines mRNA based. Have you heard about that?
Well, it should concern you. it's being used in veterinary medicine as well. I think that's the whole purpose of this thing. This mRNA platform can be such a profitable platform. You can, bring out a new variety almost overnight. So they really wanted to use this, but as this, oncologist pointed out, he'd been involved in research with mRNA. It never succeeded. It just never worked. They couldn't control it. And so they never used it in cancers, even though that might have pretty promising use right there. No, they wanted to be able to give it to billions of people, and that's exactly what they did. But again, what he's talking about is overwhelming evidence, which isn't proof. Again, they're playing word games, just like going back to what our study uncovered. I think most Americans would think the FDA's job was to, again, search for those needles in the haystack, look for unusual things that are cropping up out of their algorithms, safety signals that they could warn doctors about, that they could inform the public about. But that's not what the FDA did. They basically relied on definitive proof. Unless we can definitively prove that this is causing that, we're not going to warn the American public, because, Jimmy, we can't create vaccine hesitancy. We certainly don't want to give any reason to the FDA not to approve this. First of all, just general approval, and then for children, and then for really young children, because Biden wanted to mandate this in the military. He couldn't do it without approval. So again, if you look at the timeline, that's how I do my investigations. You look at the timeline, this is so obvious and is so outrageous, which is why you hear this passion in my voice. And it's what drives me nuts that the media is completely ignoring this. But no, there is overwhelming evidence. It was in VAERS, it's across the board. And the doctor he didn't show, Dr. Adair, he's the one that wrote the study looking at 300 cases showing that plausible mechanism. He's being destroyed. All of a sudden, you got these trolls on Pub here. They call it Pub Smear, that are going back to research he published 10 years ago and just nitpicking it, which if he wants the research to stand, he's got to respond to all this stuff. They're just tormenting the guy. And that's the other part of that hearing was, okay, here are the plausible mechanisms, and here's the corruption of science and scientific research and scientific publication. It's a real problem. We need to return integrity to science, which science doesn't have it anymore.
So RFK, that was one of the things he promised, that we were going to get back to evidence-based science in our medical journals. Now, we know that the medical journals are corrupt, just as corrupt as Dr. Fauci, just as corrupt as Tony Collins, just as corrupt as the news agencies are, because they all take the big pharma money. How come that isn't happening?
Because he is up against powerful forces. He's being sabotaged and undermined within his own agency. Again, I issued a friendly subpoena at HHS. Under Biden, we got nothing in response to my 78 oversight letters. When Bobby came into HHS, we issued a friendly subpoena to force these actors in the agencies to give us documents. They didn't give us documents. Finally, he got so disgusted, turn it over. So they dumped 11 million pages on us. That wasn't to be helpful to us. That was to overwhelm us so we couldn't find the needles in the haystack. My staff's just really good. But to this day, I believe Bobby Kennedy is being undermined, sabotaged within the actors within these agencies, but also with big pharma. These folks are powerful. They know how to destroy people. They know how to destroy people's careers. That's what they're doing with Dr. Aldery right now. It's what they do with Dr. McCulloch and Pierre Corey. The people who testified before my hearings, they have their lives upended and their careers destroyed. Fortunately, a lot of them kind of come out on the back end of that, and they've rebuilt their careers telling the truth. But again, Bobby Kennedy is up against powerful forces. We all are. The only weapon we have, Jimmy, is we have the truth. And we have to believe the truth has its own power.
How discouraged are you now just about government in general when you see that something as important as our health and a rollout of a novel vaccine is completely lied about, corrupted, and then when you do discover it and you have somebody as powerful as you, a sitting senator, one of the most powerful 50 people in the whole country, presenting it, it gets completely ignored. I mean, you have to feel depressed a little bit about this, no?
Well, I sprang out of the Tea Party movement, so I'm not a fan of government to begin with. I mean, nor were our founders. We need some government, but need to be limited, because if there's a one-word definition of government, it's power. As Lord Acton properly pointed out, power corrupts, absolute power corrupts absolutely. So no, this doesn't surprise me. I would say I'm shocked at the depth and the level of corruption. But no, this doesn't discourage me. This just fires me up. This outrages me. Now, I attended an event for a premiere of The Duty to Disobey. The harm caused to the finest among us, the members of the military, how they had their, the ones that I really feel sorry for are the ones who potentially died or had the serious adverse events. But the ones who are just discharged, same thing with firefighters. All these people that were discerning, that had skepticism, which, by the way, is a one-word definition of science, is skepticism, that refused to take the jabs, they lost their careers, whether it's in the military, firefighters, nurses, doctors. Again, people's lives have been destroyed, not just with the adverse events, but pushing up against these powerful forces. And they're still in place, and they're just as powerful.
I'm very pessimistic that any of this good work is going to come to anything. Do you think that this will come to anything?
Well, I'm on your show.
Okay.
It is getting wider, more widely known. So those of us who are doing this, we just have to keep pushing the truth. The beauty of it, just like Bobby Kennedy, the story of him getting involved in vaccines, right? Environmental lawyer giving talks, and these moms would show up with vaccine injured kids, and he didn't want to touch them with a 10-foot pole because he knew how dangerous it was, until one mom showed up on a step with stack full of signs saying, "I'm not leaving till you read this." To Bobby Kennedy's credit, he read it, and he couldn't close his eyes. He couldn't turn his back. And Jimmy, that's what I'm finding for all the people who, I shouldn't call it, my daughter was graduated from Johns Hopkins, absolutely pro-vaxxed. Then she read Dissolving Illusions. Her eyes were opened. So once your eyes are open to this, once you have met the injection or the vaccine injured, you can't turn your back on them. I wasn't going to run for a third term, but I met Brianne Dressen. I met the injection injured. I hugged people a man whose child was killed by these injections. You can't turn your backs on people like that, and you can't close your eyes. So that's what we've got going for us. Once people see the truth, unless they have such cognitive distances that just can, and a lot of people are like that, but an awful lot, their eyes are open, they're not going to close them.
Would you call the rollout, the implementation, and all the lies surrounding it, would you call it evil? Because I would call what the COVID, a whole narrative was just evil that was committed upon unsuspecting people who actually trusted the medical establishment. Now, by the way, the trust in the medical establishment was 74% before COVID, and now it's down to somewhere around 30 or something percent. So people don't trust them anymore. Would you call it evil?
It's absolutely evil, and let me tell you exactly why. So if you're a parent and you're listening to Peter Marks telling you these things are safe and effective, you're listening to the president, this is a pandemic of the unvaccinated, that you have to inject your child so your child doesn't transmit it to your parent or grandparent, because they'll kill your parent or grandparent. And so you inject your child, and that child doesn't wake up from sleep that night. Okay, that happened, Jimmy. What else can you call it other than evil? And unfortunately, that happened. The adverse events happened to millions of people more after Peter Marks was told that the adverse events were going to be masked. After senior FDA officials saw the safety signals that were screaming at them, again, 280 deaths on average to 21,000 in 2022 or 2021. But they clung to their safe and effective. Adverse events are rare and mild, and people bought it, and people died, and people were permanently disabled. So I don't know. It's absolutely evil in my book.
I think one of the most evil things about it was that they lied to pregnant women and told pregnant women it was safe for pregnant women. In fact, they needed to take it to protect themselves and their babies. In fact, here's a little testimony from another one of your hearings that talks about this.
Patients, I focus on the most vulnerable patients, pregnant women and preborn. It is difficult to conceive of a more egregious breach of medical ethics by the government-controlled medical industrial complex than the promotion of COVID-19 vaccines to pregnant women, thereby, through transplacental transfer, effectively vaccinating their unborn and newborn children. This campaign was not accidental. It was calculated. Pregnant women were targeted deliberately for two reasons. First, women are the primary decision makers of healthcare across the human lifespan, a known marketing principle. Number two, pregnant women are the most vulnerable patients. If they could be convinced that the vaccine was safe and effective, it would imply that it was safe and effective for everyone. From the outset of the pandemic, this vaccine campaign was never grounded in biological science, but rather in behavioral science, specifically the manipulation of public perception through influence, fear, and persuasion. The federal government outsourced much of this psychological operations to NGOs which disseminated emotionally charged and misleading messaging. These entities falsely assured pregnant women that the vaccines were proven safe and essential for maternal and fetal newborn health, despite the fact that early evidence indicated quite the opposite. Pregnancy itself was protective against COVID-19 maternal mortality. Dr. Jay Winston, an initiative director at Harvard School of Public Health, described the government's vaccine marketing approach in a 2020 CBS News interview. He explained that the strategy was to, quote, go for the low-hanging fruit, those easiest to pick and harvest, end quote. And the fruit, in quotes, tragically, were pregnant women. Only this deception was institutionalized in the now infamous Shimabukuro study published on April 21st, 2021 in the digital version of the New England Journal of Medicine. 21 authors claimed the miscarriage rate was 12.6%, but the raw data revealed an 82% miscarriage rate in women vaccinated during the first trimester. This figure mirrors the effects of chemical abortion drugs such as RU486. Also, in the same journal edition, on the same day, an op-ed appeared by CDC Director Rochelle Walensky and Journal Editor-in-Chief Eric Rubin. These publications were riddled with conflicts of interest and deliberate misrepresentations intended to coerce pregnant women into taking vaccines. Subsequent studies have also claimed that COVID-19 vaccines are safe and effective during pregnancy and have been rebuked by respected researchers. These publications are fundamentally compromised by serious conflicts of interest, ranging from biased funding sources and institutional mandates, and even threats to their medical licenses and board certifications. Between 2020 and 2022, pharmaceutical companies paid $1.06 billion to reviewers at leading medical journals, the New England Journal of Medicine, JAMA, Lancet, and BMJ, thus corrupting the peer review process. At least 6 existing studies, 3 from CDC, FDA, and 2 from Pfizer, revealed major breaches in safety signals for COVID-19 vaccines and pregnancy. These findings were ignored. Conversely, countless independent researchers with no conflicts of interest published findings that contradicted the false narratives and the pharmaceutical industry narratives, only to be rewarded by persecution, censorship, and threats to their medical licenses and board certifications. This is not hypothetical. It happened to me.
So I know you have to go. I appreciate the time that you've given us. I appreciate the time you've given to this issue. Is there anything? I mean, that's just unconscionable, the stuff that he's revealing. And again, it's just evil. And my ability to convince people that I know about this is not good. I don't have a good track record. People just they glaze over. They're impenetrable to facts because I think their belief in vaccines, especially the COVID vaccine and the COVID narrative, is what they call a load-bearing belief. And if you take that belief away, their whole self-identity will collapse. And so that's what we're up against. Anything you'd like to say before you say goodbye?
Well, again, basic human nature, people don't want to admit they're wrong, so that's a problem. But that was one of my public events before I became chairman. And we generally always invited the Faucis of the world, the Lewinskis. I mean, the people that impose this on the American public to come testify, tell your side of the story. They wouldn't even respond to our invitations. So again, I have, for a number of years now, held public events, held hearings, fabulous witnesses, highly qualified, eminently qualified, and the basic reaction to most of the legacy media is completely ignore it, because they cannot refute it. There's not one thing that I've said during COVID that's been proven wrong. As oftentimes as they try and PolitiFact check me and say I'm wrong, I've not been wrong. So again, you got to hope, Jimmy, that telling the truth will eventually break through. It's starting to break through. It's slow progress, not as fast as we want it, but we're not going to give up. I'm not going to give up. I'm sure you're not going to either.
And just so people know, when you see someone fact-checked by a group called PolitiFact or factcheck.org, they're getting money directly from pharma institutes. Like factcheck.org takes money directly from Johnson & Johnson. And so but that's all hidden, and they don't want you to know that they're not actually a fact-checking organization. They're a propaganda organization pushing a narrative and have a bias that's pro-big pharma. So I just want to let people know that too. All right, we have to let you go. Senator Ron Johnson, thanks for doing this report. Thanks for doing the hearings, and keep going.
Thanks for having me on. Take care.
Okay. Everybody, come see me on tour. I'll be in Spokane, Tacoma, Los Angeles, special video panel show with special celebrities. And then we'll be in Levittown, New York, Rosemont, Illinois, and Chicago. Go to jimmydore.com for a link for tickets.